Hi everybody, welcome, and today we're going to discuss whether you, yes, you should be a registered nurse. So tune in and we're going to send this right now. Before we can even get into the nitty gritty of if this is a good field for you, if the profession, we got to go through the official definition, so just give me like probably a minute or two. Okay, so what is the actual definition of nursing? The actual definition for the nursing profession is the professional practice of taking care of the sick or the infirm. And so as you can tell from that, it is pretty much encompassing the basic part of it. But one thing about nursing, and especially if you do go into it, you will learn that with nursing, there's an art and a science to it. And so with that, you are taking both of these aspects and you're putting it into your practice. So the science part is the clinical information. It's the training, it's the textbooks. So for instance, if you see that purple thing back there, that's actually my bachelor's degree. So that shows that I've had certification, that I'm able to take care of people. The actual art of taking care of somebody, that is the beautiful part of nursing. That's the passion, that's the empathy, that's your own unique twist of how you provide care to your patients and in your practice. And so that is what each individual person brings to the table, and it's a unique aspect. And as I've mentioned previously, we're all learning out here. And so that's kind of one of those aspects where it's like, you learn from each individual and you're always learning something new in nursing. So now we're going to get to the nitty gritty, why you should be a nurse and why you shouldn't. So we're just going to start off with the basic on why you shouldn't be a registered nurse. So first of all, if you are in this for, that money, that cheese, that bread, girl, no. You might as well stop right now. You might as well stop this video. You might as well start looking for something else. It's not worth it. Again, I am located primarily in the South. This is where it worked. I've yet to make six figures, and I'm very honest with that. So again, if that's your main aspect, is to try to get the whole, oh, I want to make money and all that. No. We don't make that much money. Just saying. Okay, so my second topic is, if you think this job is glamorous, no. Oh, this is a big red flag besides the money, because there are some people out here who are doing it for the money. I'm just gonna be honest with you. I ain't gonna sugarcoat it. I even said I'm not gonna sugarcoat anything. But the majority of those nurses are really miserable, okay? You're gonna be working for a while, so you might as well enjoy what you do, okay? Just being honest. Nurse truths. But if you think this job is glamorous, it's not. We are in people's very private areas. We are dealing with blood, we're dealing with poop, we're dealing with pee, we got vomit at times, we're dealing with other excretions. I mean, y'all, this is not glamorous. This is not about, oh my gosh, my hair, my makeup. Nobody cares, because the majority of the time, your face is covered up. Like, your face is covered up with a mask and no one can tell. This is how the majority of the time you're seeing people. It's like, oh, hey, where's that patient going? See, no one cares. Majority of the time, I'm gonna be honest with you, when I used to work on the floors, I actually got made fun of a lot because my hair's all over the place. Because again, this was during COVID, so we rocking our little mask, and then got my hair up like this, okay? And then the majority of times it's like all over the place like this. Like, it's just like, are you ready for a report? I'm ready to go. So if at any point again you think this is glamorous, it's not, guys. This is real life. We take care of real patients and we get into some very deep places, and yeah, and we're there during the worst times for some of these patients. So again, if you think this is glamorous, it's not. I'm sorry. Sorry, people have been lied to. So, nurse truth. Okay, so our next topic is, if you have an ego and you like, it's my way or the highway, all this little, no, just stop. Just stop. Just stop. You're not going to enjoy this because guess what? There are people that have dedicated more time, if you do decide to go in, more time into healthcare than probably you. We have providers, we even have fellows and the residents. They have been in school longer than you, okay? And technically it's the provider's way or the highway. Providers and administration. You're just a middleman just trying to make everything work, okay? So if you're that type of person, you know those A type of people, this may not be your thing, and that's okay. But just telling you the truth, just take the advice. If you're not good with team players and being a team member, just stop. You might as well stop as well, because guess what? That's all we do. We're team. We work together. We get the patient from point A, B, to C, to home. Or sometimes not home. But that's how it grows. You will always be in team, whether you're working ER, ICU, OR, float pool on the floors, you a med-surg nurse, you working in the clinics, you working in a fusion clinic, you work in a skilled nursing facility, you're working in a rehab center, you're working at a dialysis center. See, I've just named 10 areas of nursing where it's all about a group of people. But Katie, what if I want to do administration or something? Same thing, y'all. You still working together with other people. Even if you're a manager, you're talking to the CEO, CFO, you're talking to other managers. It's all about a team network. Even in informatics, maybe insurance, you're a little bit more alone if you can get a work from home job, but still, you're still part of a team. It's still bigger than you. So if you're not okay with the bigger picture and being okay with being part of a team, just stop. Red flag, y'all. If for instance and then the biggest thing I would tell you is if you do not like people, just stop. I'm gonna be honest with you. Even if you're not a floor nurse, because with the floor nursing, the majority of these individuals and these nurses, they work 12 hours. You get to learn a lot about a person in 12 hours, especially if you're having to be in that room a lot. I mean, it just helps pass time more. And again, that's part of that holistic part of nursing. If you are in this for the money, if you're not a social person, if you have an ego and you don't like to work with other people, don't do it. It's not worth it. And then that leads to my fifth topic of, if at any point in time you're in this for other benefits besides the money, besides, whatever it may be, you're looking for Dr. McDreamy, McSteamy, Dr. McHunk, whatever, just move on. Like, you're better off just going on a social media page or doing a dating app and trying to find somebody like that. It doesn't work here, so just let you know. So now the biggest thing is why you should be a nurse. This is going to be the favorite part of mine. So if you are somebody who truly cares about people, we need you. Yes, we need you. And if you are good under high stress or high levels of pace and you can do well under those, yeah, we need you. But the biggest thing I would tell people is, should I go into nursing? Should I not? Is if you, big three, if you are a fighter and you're willing to fight for your patients, fight for the families, and you're willing to fight for your profession and other people, we don't just need you, we want you. Because what we're going through in healthcare and in nursing, 2023 and moving on, is we are going through a lot, and we need these stronger individuals to come into our practice. And I really think if you're in this for the right reasons, you're gonna find that you're gonna do great. Yes, you're gonna go through some very difficult times. It's not going to be easy. It never is easy taking care of people or being there during the roughest days the majority of the time. with our patients in the hospitals, or even in the clinics. We get some patients where, you know, we have to tell them bad news. And so it's very difficult doing this job. But if at any point you feel that you can care for people, you can advocate, you can fight, and you really, truly care and have a passion for this, we need you in our field, and we will embrace you with open arms. So I just want to say, I hope that encompasses everything. And if you have any questions or concerns, comment below. Let me know if I'm doing something wrong again. We're all out here learning. And please, 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 again, if you're not sure and you're like, maybe, go talk to somebody. Go talk to neighbors. Go talk to family. Heck, go talk to your doctor. Just call them up and be like, hey, I'm interested in nursing. I don't know where to turn to. Is there a way I can shadow somebody? Talk to the human resources department at the local hospitals. I'm sure they would not mind trying to get you to shadow, maybe volunteer, train someplace. Let us know. We're all out here. We want you. We need you. So I hope y'all enjoyed this content. I hope y'all enjoyed the video. Subscribe below, and I'll see y'all next week. Bye.